The Sarah Cannon Cancer Institute here at Menorah Medical Center, they treat a lot of cancer here. I'm Richard Sharp with Your Health Matters. Inside those walls, they have a unique device that helps people keep their hair when they're going through chemo.
This is the inner cap, the silicone. That goes on first. It is heavy. The whole thing is really heavy duty.
Nancy Ash shows off the DigniCap.
It gets cold. It gets really cold. And when you take it off after your infusion, you literally have frost on the inside of the cap and on your hair.
It works by cooling the head of a cancer patient while they undergo chemotherapy. Ash says the cap saved her hair.
I know looking at me this way, it doesn't look like I have much hair, but I have plenty of hair left. And I wouldn't have had otherwise, I don't think. And I think it's important to say now that I'm not out of chemo, but maybe 2 to 3 weeks. And I just was so grateful that it was available to me.
But the cap did much more than just save her hair. It changed her emotional outlook and state of mind during treatment.
It was a really big deal. I felt normal. And when you get that diagnosis of cancer, nothing is normal. Nothing is normal anymore. Everything about your life has changed. Everything looks a little different. And it just was huge to me to know that I was going to be able to at least look like I was well.
Ash is one of many who use the DigniCap. Dr. Stephanie Graf explains why this device is making such a big difference in treatment.
When it comes to breast cancer or any cancer in particular, for a patient to find out that they're going to lose their hair as a part of their treatment is always a big emotional blow. It's one of the most common times that a patient kind of loses control and will cry during my consult. I love that we have a solution like DigniCap for patients that they are really focused on that and that that's a big deal breaker.
Dr. Graf says it's like the beautiful piece of artwork in her office, given to her by a patient. Appearances can be important and can make a huge difference in cancer patients who don't look like cancer patients.
If you're going to feel good some days and bad some days on cancer treatment, your good days, you want to feel as normal as possible.
It's a fitting name, DigniCap. It really does help people keep their dignity. With Your Health Matters, I'm Richard Sharp.